So as FMG exam is over, let's have the recall. In overview of the exam, I will say that FMG 2026 was a difficult exam. Many faculties are saying that it is easy or it is moderate. But if you see the FMG pattern, in the last paper also it was difficult, and this paper also it is very much difficult this year. Being a NEET PG former topper, I can say that this paper was difficult as compared to FMG. They have shifted more towards the NEET PG. So this is like a NEET PG question paper. So इससे पता चलता है कि FMG it is going to be tougher day by day, and we have to prepare accordingly. So coming to the first subject, that is anatomy, there was identify a marked structure in section of brain, and the image was of corpus callosum. So it was pretty simple. Identify a triangle, image was given, and submental triangle was given. Identify the artery, it was given, and it is also present in my digital image bank. The images which are present in my digital image bank, I have written DIB, that is digital image bank, and the images which are extra I have written in bracket image, which are not present in my digital image bank. So I've seen by the recall that 40 to 50, at least 50-60 questions directly came from my digital image bank. It was more image based question. So if you also want to have the digital image bank, the link is given in the description box below and the pinned comment section. So it was, the image was of interventricular artery. Ansa cervicalis was shown, and it supplies all except the thyroid. This ansa cervicalis was also present in my digital image bank. Identify the muscles with its action. Dorsal interossei was given, and the function is abduction. Pad and dab. Numbness near mandible, which nerve was shown? So it is the inferior alveolar nerve. X-ray leveling of coracoid process, clavicle and acromioclavicular joint was shown. Fracture of supracondylar area in digital image bank also it is given. So the image was given, it was of median nerve. While doing endoscopy, the constriction was at 40 centimeters from incisor. Cause of constriction is diaphragm. Varicose vein image was given, it is the great saphenous vein. Identify the muscle from medial to lateral. This was a new question. So first is the psoas major, then comes the psoas minor, then quadratus lumborum, then transversus abdominis. Tracheostomy is done in between second and third tracheal ring. Now if you have any confusion or the question is not recalled properly, which can be a fairly possible chances, then you can let me know in the comment section below. I will provide this PDF in my Telegram channel, so join my Telegram channel. The link is given in the description box below. Identify the marked structure. Lingual swelling was shown. Which ligament is shown in the image? So the image was of anterior cruciate ligament. Identify the muscle with its action. So it was, I have covered it previously only, so it is a bit repetition. Physiology, pressure volume curve was shown, and at the point C it was aortic valve opens at that point. Rio based chronaction and utilization time, this is an INICET based previous year topic, but it has not come in NEET PG or FMG. So they are trying to ask INICET previous year topics also in the FMG question. In case you have already given this exam and you are watching this video, with this you can estimate what kind of marks you are going to get. And others, if you are watching, if you are a future FMG aspirant or a NEET PG aspirant, then these questions are important because there are fairly high chances that FMG questions are repeated in the NEET PG and FMG questions are repeated in the future years of FMG. So a head trauma patient with hypertension, bradycardia and high intracranial tension, identify the reflex. So it is Cushing reflex. Cheyne-Stokes breathing image was given, it is also present in my digital image bank. Iron folic acid supplementation, which vitamin to be added to increase the absorption is the vitamin C. Action potential curve, lowest sodium potassium conductance is during the hyperpolarization phase. Action potential curve with no new impulse generated during depolarization of action potential, sodium channels are inactivated, that is the reason. Botulinum toxin, presynaptic blockage of synaptobravin, and blocks the exocytosis of acetylcholine. Head injury, speaks fluently but can't understand, so it is Wernicke's aphasia. high altitude mountain sickness, the best treatment is to descend the person to a lower altitude. Pregnant female, third trimester, short breathing means rapid breathing. Identify the statement means what is the condition. So it will be hyperventilation, and hyperventilation causing CO2 washout, that is causing respiratory alkalosis. pH is 7.2, PCO2 is low, bicarbonate is low. So in the same direction it is acidosis. So ROMS, that is respiratory opposite, metabolic same. So this is a case of metabolic acidosis with respiratory compensation. In pressure volume curve of bladder, 1B is denoted by law of Laplace. It is also present in my digital image bank. A patient undergoes surgery where one lung is removed due to malignancy. Which of the following parameters should be measured to accurately assess the remaining lung elasticity independent of the lung volume changes? So the answer is specific lung volume. A 4-month-old infant, cardiomyopathy, acid maltase deficiency, it is a case of Pompe's disease. Self-mutilation, Leishman syndrome, HGPRTS deficiency. Tall with arachnodactyly, lens dislocation, aortic dilatation, fibrillin 1 mutation, Marfan syndrome. Steroid hormone binds to the zinc finger motif. A patient with night blindness, retinitis pigmentosa, increased phytanic acid, and you can see ichthyosis also. So this is a case of Repsam disease. Crumpled tissue paper appearance is seen in Gaucher's disease. It is also given in my digital image bank. A child with hepatosplenomegaly, histology shows foam cells. This is also a new question where the histology is showing foam cells. It is a case of Niemann Pick disease. A neonate, another difficult question, with severe seizures with low citrulline level, hyperammonemia, normal orotic acid, and high glutamate. So the answer is type 1 hyperammonemia. Which of the following has high chylomicrons? So this is lipoprotein lipase deficiency. Which enzyme conversion is defective in uroporphyrogen to coproporphyrogen 3, that is uroporphyrogen 3 decarboxylase? A child with easy bruising, bleeding, physical examination shows multiple ecchymosis and purpuric lesions. So this is a case of vitamin C deficiency. DNA matching used to identify among the parents. So what sequence is taken? Short tandem repeats. A chronic alcoholic non-veg diet having GOA, that is global confusion, ophthalmoplegia, and ataxia. The vitamin deficiency is the thiamine. A patient with hepatosplenomegaly and joint pain, investigations suggest abnormal intracellular accumulation of macromolecules such as lipids and glycoconjugates. Which cellular organelle is primarily responsible? So the answer is lysosomes. Now, if you are watching this video, then share it with your friends, with your fellow NEET PG and FMG aspirants. If this video hits, then only the next parts are going to come. And the PDF you will get in my Telegram channel. So join from the description box below. All the best.